Unmuted.
Yes.
So, good morning, everybody. I am Dr. Chandrashekar, Vice Chancellor of Dr. NTR University of Health Sciences. So, as a part of the medical education, so every month we are doing a WebEx meeting. So, for which today's guest is Dr. Chandrashekar. He studied at the Karnool Medical College. I think Dr. Surya Prabha will tell about detail about his brief history. Before that, as you know that the science is evolving day by day, the Honorable Chief Minister of Andhra Pradesh more interested in our Honorable Health Minister and also the Secretary. So the university also will be forefront since it is a first of its kind in the entire country, medical university. So on this basis, we are going for the AI technology, quantum physics, and all. So for which the speaker has come from states, is NRA, and I on 28th of last month, Dr. Sai Sudheer, Professor of Forensic Medicine from Karnool Medical College, has joined as a registrar of the NTR Health University. Since Dr. Radhika Reddy has completed a tenure for 3 years, so the doctor has joined. I request Dr. Sai Sudheer will say a few words before Surya Prabha reads the biodata of Dr. Chandrashekar.
Sir, thank you, sir. Good morning to all the principals and other dignitaries who attended the meeting. Sir introduced me. Welcome to all to this session. So all of us know now this is the digitalization era, and our government and our Honorable Chief Minister and Health Minister are also interested, and they are also doing the digital governance and the WhatsApp governance. They are the future of the academics or the administration, whatever it may be. So our Chandrashekar Garu, who was the alumni of KMC, so he is doing his best for sensitize you all regarding the implementing the artificial intelligence powered NMC based CBME curriculum. So this is a new concept here. So with all support of Vice Chancellor sir and other departments here, he will explain everything for you. I request you all to be patient and make majority of the persons to involve this training session or the academic session, and because it is the future what we are going to implement and has to follow. Welcome you all once again. Thank you all.
I request Dr. Surya Prabha read the biodata for Dr. Chancellor.
Good morning all. Sir, Honorable Vice Chancellor sir, our new registrar, Dr. Sai Sudheer sir, our guest for today's WebEx meeting, Chandrashekar Garu and his colleagues, all principals of different medical colleges affiliated to Dr. NTR University of Health Sciences, faculty members, medical education unit members, and the students of medical colleges. Good morning all. As you know, artificial intelligence is transforming diagnostics, treatment, and other modalities in our healthcare system. But now there is a chance now for artificial intelligence in medical education, and especially competency-based medical education. From 2024 onwards, new guidelines have come from NMC, and there is related with artificial intelligence in health education and medical education. So Dr. Chandrashekar came from USA to give his concept related with artificial intelligence in relation to our medical education. Let me introduce Dr. Chandrashekar Bandugala. He is from an alumnus of Kurnool Medical College, and presently is working with USA government, where he is the founder and CEO of SHC Technologies Private Limited. He is a medical educator, physician executive, artificial intelligence researcher, and global speaker. So he is an ACGME designated institutional official with 11 plus years of experience, founded 2 brand new GME programs in the USA, expanding residency opportunities, integrated medical economics and administration in medical curricula. And he is the chairman, Graduate Medical Education Committee, and senior physician executive with 25 plus years of experience, and ACHE board member at Alabama chapter of USA. He is a guest lecturer, value-based care program, Boise State University, USA. And AI mental health app. He has developed AI related products for teaching and learning in medical education. AI mental health app, Ayush AI app, multi-agentic healthcare system, AI co-scientist, computer vision and image analyzer, AI chatbots, AI maternal health app, and AI PPH manager. These are all his contributions towards artificial intelligence in healthcare delivery and healthcare education system. Now I request Dr. Chandrashekar sir to take up the platform. And I request everyone to actively participate, especially faculty members. Please, AI is a new tool for us, and whatever we do have as our doubts, please, you can ask all those questions to Chandrashekar Garu so that we'll have a clear-cut idea related with what we are going to implement at our colleges level. Thank you, sir. Thanks for the opportunity given to me to read.
Good morning, everyone. Sir, Honorable VC, sir, thank you so much for allowing me to present this. And Dr. Sai Sudheer, sir, our registrar, he is also senior to me in medical school, 5 years senior, sir. And thank you, Dr. Surya Prabha, madam, and also the Honorable Secretary for Health and Human Services, Sri Saurabh IAS. And all the principals, the additional principals, faculty members, and also the coordinators in the medical education, and also the students and other learners who have joined this webinar. So thank you everyone for joining early, and I really thank our VC sir and also the Honorable Secretary. So when I came to visit Dr. VC sir, he was so impressed with AI. He was really interested in implementing AI, and so that's how it started. And today we are here presenting it. So so the way I take it, the presentation is, first I'll give a brief demo about the presentation about what's this about CBME, why we have built the CBME, and how it's going to help all the stakeholders in medical education. Then I'll take to the real presentation. I'll give you the demo of the application for all the stakeholders, from students to faculty to HOD, the principals, the Vice Chancellor, DME, and the NMC. So all these stakeholders who are important in this CBME and education. So I'm going to take it forward. Thank you. So I'm going to start with the small presentation. So first I want to also, respect my professors and teachers from my medical college, and who have shaped me to become an educator and also an administrator in medical education, with all my humble respect. Let's start from the beginning. This is we are implementing AI-powered NMC competency-based medical education. Right now, as you see, it's all paper-based, and 400 pages you have seen, and we have converted that all 2,600 plus competencies into digital format using the AI. And there are the current challenges right now. You see, so it's all manual competency tracking. There's a lot of burden for the faculty also, and also paper-based logbooks the students are using right now. Students have to chase the faculty and to get them signed, and there are compliance audits take a lot of time. Plus, there's lack of integration, AI integration in the curriculum. Plus, there's lack of transparency also. In medical education, we need transparency between all the stakeholders. So these challenges, this Edmed AI is the solution, which we call Edmed AI India. So we are using it for India. So we using the 2024 CBME based curriculum, we have created this one with all 19 medical subjects and with 2,695 competencies and 162 simulations. So it covers the all these like AI tutor, AI simulations. You might have heard it, EdCom and FAP modules, AI medical research, digital logbook, and so on. So we will cover all those in the demo. Plus, if you see it, how it's aligned to the NMC aligned learning. So it's a subject-wise NMC competencies organized in the app. If you see, we have preclinical, clinical, and paraclinical. Students only see subject-wise, year-wise. For example, if they're in first year, they only see anatomy, physiology, and biochemistry. So as they progress in the years, they'll get to see the next level of subjects. So then the topics are based on teaching care. For example, anatomy, they have given topics. Within the topics, they have given the competencies. So we have organized them in that format. But also what we did is we have combined them into categories. Just like, it should not be just like anatomy, physiology. It should also be multidisciplinary for each and every topic. So that's what subject integrations we have done. And so aligned year-wise the subject and competency distribution, it maps to all the 3 MBBS phases, and faculty also can lock and unlock the competencies. For example, if the faculty is teaching only one session, he doesn't want the students to see all the sessions. So until the faculty opens that, the students won't be able to see that. So in order to prevent the confusion for the students. So we also have AI simulations hub, which will use the DOPE methodology, which is like demonstrate, observe, assist, and perform. So I know you all know this, but I'm just giving you as a presentation. So there will be simulations for each subject. There will be clinical simulations, and also simulations are also based on the subject plus the competencies. Wherever the competency needs a simulation, that has covered these simulations also. And also you get the video recordings and medical images for the students or faculty to utilize them. And the faculty also can choose them and select them and give them to the students, which videos or images the students can use. And also we make very important that you have the compliance, that attendance has to be maintained 75-80%, and also for the faculty, we try to improve the mark attendance in this one. And most important thing for the students is the digital logbook. And I see a lot of pressure in the students also. And my son also did medical school from here in Manipal. I have seen him struggling with, writing the books and searching, going and fetching the professors. So it was so much of work for both the faculty and also the students. So both ways, I think it will solve the problem. And also it will give you the AI medical research. So it's very important that now our medical students should engage in the medical research. And with this AI, it has become such an easy one. You don't have to go through all the literature. The AI will help you to bring the best literature for you in hands. So if you want to be competitive in the world, if you want to compete with the Western countries and other nations, we have to step up in research. So that's something that I've seen in US and other places. So same thing that we want to implement here. And for faculty also, they can create AI-powered case studies, lectures, and quizzes. So right now, faculty are creating based on they have to spend a lot of time on creating lectures, but the AI can help them create better lectures and also cases, so that it won't waste their time. The faculty time has to be saved. Faculty can use that best time to teach students than creating these materials. So that's something we have tried to implement. And also the faculty can save that and send it to keep it in the library. Within the library, all the medical colleges can utilize the same lecture, so that instead of everybody creating the same lecture on one topic, so one college, a professor, a team in one college can create this lecture and share with all the colleges. So that way we can implement the learning management, the learning health system, learning medical education system. That is something can be done through this AI and the platform. So I worked on the learning medical system in US. I've seen the advantages of this. I thought it would be a good thing to implement here. For students, you have the AI tutor. Anytime you can ask the tutor, just specific to that module, specific to that competency. So you don't have to go and search outside the competency study there. So you can it creates the smart quizzes for you, and you can do the 8-count FAP, longitudinal tracking here, and also these medical exams like. You have NEET, NICET, and also the USMLE. So the best part of it is it gives you questions according to that module of the competency. So you don't have to go out and study, you can just prepare here. And for the medical colleges, so it's fully aligned with the CME standards and CBME standards in NMC. And we will give you an admin dashboard with AI analytics. So it's a centralized dashboard for both the HOD and also the principal. So they'll have these dashboards. One click you can see what's happening. So you don't have to get the papers from every department, but you can see it from here. And you can also monitor the faculty attendance. You can also monitor. You can also create the lectures for the faculty, and also you can alert students, or as a mentors, whoever the faculty should be the mentors. The HOD can decide. So through this application. So. And also, this will take you from the phase-wise growth, like from know to know how to show how and progress. So this is how it will progress till the last year. So this is what you will see here. And also, it's easy for also the colleges to see how many faculty you need based on number of students as per the NMC requirements. So this will give you a dashboard of all the, even for example, VCS can see all the medical colleges, how many faculty are missing, and how many they have to recruit. So especially for the private medical college, when you're opening a new medical college, this is something you have to, it will be helpful for you. And for the university custom dashboard, as I said, and it is compliance with the NMC, and as university is more focused on, on the education side and also in the compliance for each college, we tried our best to create a good dashboard for that. And with that, the university will have a performance heat map, like whether in the college competency has been completed, AI simulations, FAP, and attendance ratio, outcome. So some of them, may be very helpful for the DME side also, but this is the overlap between the DME and also the vice chancellor side. Right? And so this is how we will navigate the platform. So I'll go from the top. So this just the super admin is nothing but from the admin AI side, we'll be supporting you in every step. University, the DME, the NMC side, plus institutional admin, the dean or the principal and the HOD. We'll also manage, faculty can also be managed with HODs, and faculty can manage the students. So it's a hierarchical, but also very from bottom approach and top approach, we can say. So to make it very easy to go through this platform. So Surya Prabha madam has talked about me. So I'm proud alumnus of Karnal Medical College, proud to say that. And this is like a giving back to my college and my state. So I feel honored to do this. So these are some of the workshops I have done for different medical colleges, AI in medical education and critical care, faculty development program I have conducted, many of these, but few of them I have mentioned here. So to upskill the AI curriculum and also the faculty and students. So this is how we would AI would admit AI would better engagement of university and the colleges, and monitoring I would say is helping you and also supporting you in one unified dashboard. So if something is you're missing resources you need, the university can manage, the DME can manage, any higher level administrator can manage. So and also it's 100% digital competency. We said 35, actually we have 38 universities. So recently I heard the Honorable Chief Minister said we have to reduce the workload of the staff and employees of the state. So I can say that this will reduce 40 to 50% of the faculty and administrative burden. And also students also, it makes their life easy. So this time we can utilize for like research or doing something good. And NMC compliance, you can do audit trail with attestation and assessment times. So enhancement of skills and AI adoption for the faculty, students, and the management. So the aim is improve the core competencies of medical graduates by 20 to 25% every year. So if you start first year, for example, we start first year, by fifth year they come, final year they come, they should be 100% competent with learning the things and what we want to accomplish in the next 5 years. I think one batch can completely become tech savvy, completely, what is the mission of the NMC, mission of all. So in 5 years, we can make these students become that. So as you said, this is built by the doctors only for the future doctors of India. So I'll stop here and I'll take you directly to the product. So if you have any, anything. So this is the application, Edmed AI. So the name is like medical education and AI. So it makes very good Edmed AI. So that's the name we're taking. And if you want to go to app, so I think this is how the application landing page will be, whatever I talked about. So the main mission of Edmed is like empower every medical college in India with AI-driven competency-based education. And also vision is to create brilliant doctors for India and world through AI. So that's the mission. So I also thank the CBME, the NMC curriculum members who worked very hard to create this competencies. It's not easy. I've gone through each and every curriculum, how much time they might have spent. So I really, really would like to thank them for doing that. So I'll take you to that. So the first I'll start with the students. So we'll go very quickly. And the first thing, dashboard. This is for the student dashboard. If you can see, so to quick access, you have the digital logbook, you have the EdCom, you have the internal assessments, you have simulation lab, attendance, family program, online quizzes, and faculty feedback. So these are quick, you can see here. So NMC compliance tracking, you can have attendance, how much attendance. So before I take it further, I want to say that this is not completely real data because we have not used the college. So we have used some data for explaining how it works. So please, if any college is seeing negative or positive, please forgive me. It is not to show the college as low performing, high performing. It's just for the representation purpose. So I just want the disclaimer first. And we have, if I take the first one, I'll take to students. You have the first preclinical, paraclinical, and clinical. So this is a student from first year, anatomy, physiology, and biochemistry. So you can see here 3 subjects for him or her, and the EdCom. So this is like 27 topics are there. It's a longitudinal competency. So if I click on anatomy, what you will see, this is what you will see in anatomy. For example, these are the NMC topics. These are the categories, what there are. 82 topics with 415 compliant competencies. So you can see knowledge, skill, attitude, and communication also. So if you here, like I said, only if the faculty member unlocks this, the student will be able to see. So for example, if I see one student, this is open for a student. You see the competencies like this, AN 4.1, 4.2, 4.3 like that. And you also see this is large group teaching with the demonstration, and assessments are written and Viva OC. So there are two simulations for this one, and this is a knowledge-based one. So if I click on one of these, like if I click this one, it will take you to the page. So here, so describe different types of skin and dermatomes in body. So this will give you a small topic on this. So like it talks about types of skin. It will give you a very quick one. So if you want, you can have access. We can give you more, but this is a very neat one. It will also give you mnemonics to learn. It will also give you clinical pearl. So in this topic, what you should remember. And also sometimes they'll give you exam tip, what you should remember here. So these are the three very important, and also gives you the clinical relevance. And if you want, so it also gives a lecture, video lectures. So like introduction to skin anatomy, and you can go through multiple videos if you want to learn. Or a faculty can select one of this. If they like one, they can just choose it and give it to the students or keep it in the library, digital library. Then you can also, for learning medical images, so you can take these images. So you can, any image you can select and learn. Yeah, so it will look like this. And practice quiz on the same topic, on the same competency. So you can do the practice quiz based on this. For example, which type of skin is characterized by thicker epidermis and fewer sweat glands, like that. So then I'm just going to click one random. So let's take it. So it's wrong answer. So it will also show you why it's wrong. So which is right and why it's wrong. So you get to see, and you will have multiple. You can create more. If 5 are not enough, you can create more. So based on the topic. So here you also can, in this module, in this competency, you can also prepare for NEET. What questions come in the NEET PG? So it will show you that. So you can see here. So NEET PG pattern, medium level question. So you can see here these questions. So you can just say, check answer. So it will give you the answer. You can go to the next question. It's the same format, same way in a set. Somebody is preparing for AIMS and other thing. And if you are preparing for USMLE, the same way you get USMLE level of questions, for vignettes, you get vignettes in the USMLE based one. And if anybody has any questions related to this topic, you have an AI tutor here. So you can ask any questions. For that, we already created some hints for you to get that answer. So you can ask any question. Or you can type any question that you want to ask it. So here I created this USMLE questions. So you got this USMLE questions. So all three are there. And this is what from the student side, what you can get. And let's say if you are going to my logbook. So here in the digital logbook, you are here phase-wise completion. So what you see here is there are mentors, faculty mentors may be assigned to you, like anatomy, one biochemistry faculty who may be mentors to you. So you can see the names of those faculties here. And also phase-wise completion tracking, how you are completing phase 1, phase 2, phase 3, and phase 3, part 1 and part 2. This is your whole MBBS curriculum. So this is unique to you. So that's why you will only see this. So phase 1, before you finish anatomy, if you have completed all your logbooks, all your competencies, this will track. And it will show you the percentage, how much you have created. So here it is 0, but and here if I say, if you see here, pending sign off from the faculty, needs repeat. If a faculty, you submit a competency to the faculty and the faculty is not convinced with this one, so they will send it back to you, as you know, in the regular practice. And like that, you can see pending, and if anybody has agreed and approved it, it's signed. So that is signed, acknowledged by you, signed by the faculty. So this is what you will see in the student side of the thing. And also, if you want to attempt a new log subject wise, for example, I'm doing anatomy, or you can say physiology you want to do. So you will create a competency. You can see all the competencies here, whatever the competency is required. So, for example, enumerate, discuss briefly about. So you can select the faculty. This is. Select a faculty, faculty 1 or faculty 2, faculty 3. The real names will be there when you give them the name. So I'll just say. So the first attempt or repeat or remediation, you can see here. So the date performed, when you have performed this one, so it will timestamp the date. And if you have done in the ward, in the classroom, or anywhere, it will record it. So it will take the procedure notes. I'm just typing it. Self-assessment, I did well. You can say I did well. So then submit or sign off. So it will go and stay in the faculty side of the thing. Once you submit here, we go to the faculty side. So same way, if you see EdCom, so same way EdCom also you have like you can do these log entries here. Same way. So you can enter the module. You have all these modules, like if I say empathy and compassion, CA competency, this is a competency. Entry type, it's a reflection, or ethics case, whatever you can say. Right? So then it's first attempt. I'm doing the first attempt. And you can give. So you can write all these are all up for you to enter. It's already been done, so it will not. So we'll say treat patient body with respect, something like that. So this is submitted. So these are all the modules. You can also see them. You can just click on that. So that's the EdCom side of the thing. And also internal assessments. If a faculty member creates an assessment, that will be seen on your side. Here you will see that if it is anatomy, you will get that assessment question, whether it's a short answer or long answer, or even a multiple choice question. So you can see here. And simulations hub. So related, this is if you related to all your preclinical. So I can show you anatomy. You can different karyotypes and all. These are the anatomy, abdominal pelvis anatomy, cross section anatomy, and also, for example, embryo, how embryo is developed. So you can see week 1 to different competencies you can see. And you can see the organs, how they have developed, heart tube, like that. So then you can also see the anomalies, neurotube defects, tetralogy of Fallon, and the timeline. So this is timeline for you to remember well. And this is a quiz that you can do by yourself for good learning. that also shows something like so like same thing like karyotyping. It's a very tough subject. Genetics is something that always we have a tough line to learn. So you can see karyotypes. You can also see the syndromes. Um, so there are some Q&A question and answer quizzes that you can learn from that. So this shows you, highlights you what is deficient, what is excess in terms of chromosomes, or where is the deletion like that. It can show, and also inheritance patterns it can show you. So dominant versus, and you can do some practice with this one. And also molecular level, DNA double helix and how DNA, RNA, and protein interact, and these mutations, how they happen. These are all the things that you can practice in this one. And I'll take you to one very because I know our VC sir is a cardiologist, so I'll show you about one thing in cardiology. So cardiac cycle, I would be interested to show actually. So here you can see, control panel, heart rate, preload and afterload and contractility, and it shows the real time. Like for example, if you increase the heart rate, how the ECG lead will be running, and also if you reduce the preload, we will set what happen sometimes. And you can also see the stroke volume, how it changes. You can see the ejection fraction, things like that. You can also see the contractility. If you increase the contractility, see here, the blood pressure is increased, cardiac output is increased, ejection fraction is increased, and how you can play with this one. You can learn from this one slowly. So this is one way. And clinical insights, very quick to learn this one. So this is one, and you can also do some cases here. Normal cardiac cycle, heart failure type of things, like this. You can take exams also like that. And actually, you can also have the atlas. We have seen Vickers diagram in cardiac cycle, so you can see all in one place. You can learn. So that. There's one more I want to show you. Special senses is, for example, vision. We want to see, so pupil, you can see the pupil changing, the pupil size changing with the light intensity. So you can move around and play with this one pupil size. Accommodation also you can see, like focus also you can increase the accommodation with the focus distance. So these are some of the learning things for you. Same way, hearing also we can do this, like sound frequency, cochlear and audiogram. Most of you are familiar with the audiogram. So if you increase the size, sound, so you can see the hertz changing the intensity if you increase. So you can check these ones while you're doing. Then the last one is the vestibular. See, this is like ringing of the ears, or people feel dizzy all the time. So you can see high speed rotation. You can see if you do vertigo level, you see at the bottom vertigo level how it changes with this head rotation speed. You can also see the head tilt. If you tilt it, you can see moderate versus severe. And same way, linear acceleration. So you can just play with this one. This is a simulation that. So this is for the students here, and also attendance. For example, you see here location. If you are in the classroom, the student is in the classroom, the faculty will take an attendance. When there will be a 6-digit code that the faculty will give in the class. So the attendance can be taken instead of manual attendance and everything. We can when we show the faculty, I will show how it will be done. So you just enter the 6-digit and you will be logged in, given the attendance. And family program. So here, if you see, everybody is given 3 to 5 families to work with them. This is new thing. So here, Venkatesh family in Nandikotku. So he enters the family was economic status and data mother. So you just give them the, you can enter here. When you enter their family, so you can see visit type, is it home visit or health camp or survey, follow up, health education, or all these types of programs you can see. You can put your observations here also. And health education topics, you can say personal hygiene or other things. You can just say you can monitor that. So this is how you can fill all that family demographic survey. You can enter that. So now you are writing in the paper, so you can do this in digital, everything in here. So you can submit that visit, but it takes time, so I'm not taking time here. So then online quizzes and faculty feedback. So one good thing about these students, when a faculty teaches you a lecture, a class, or a practical or anything, so you get an opportunity to, for example, anatomy faculty, anatomy faculty one session type. Yeah, for example, lecture he has given. So on this day, somebody has given you a lecture. So the class was conducted. So to just see that, and you can also say that the teaching quality was very good you can give. And overall experience in your class, whether you got a chance to ask questions or like that, you can say 4. So it will, and also you can say that I like the class today because madam explained more practical points. Just I'm giving that. So I just submit that feedback. You can see that you have 5, the faculty you gave 5 and 4. This will stay in your place, in your actually. So I just wanted to know if my voice is clear to all of you.
Clear, sir. Yeah.
It is clear, sir. Very clear.
Okay, thank you, sir. Thank you. So you can also see here, this is library for you, students library. So this library, this content library is one. Either you can create your own. For example, if you like any topic, you want to read it later, so you can save it to the library. Or if a faculty member, once they are reading and they want the students to learn this topic or to learn a case study, so they can select and save it here. So then once they publish it, only you will be able to access it. So the other thing what we can do in future going forward is connecting this with all the colleges. So that will become a digital library for all the colleges. They can share the resources, they can exchange their ideas like that. So you can see case study, you can see the view details of this case study. So understanding anatomical position, body planes. So it gives the learning objective, anatomical content, visual description, clinical relevance, key points to remember, and self-assessment questions. So these are important for the students. This can be a class activity also. Then lectures, you can, I didn't add the lectures, but lectures can also be saved, and they will give you some questions, quizzes, what you have to do. So that you can keep in the library. This library is common to all of them, all of the college, all the college, but specific to your area where you in that class. If you're in anatomy, only that you will be able to see. So that's what is the student side of the thing. So I'll take you to now this is how the student side, when you finish your achievements, you'll get first step, you'll get this is like a motivation for you to do. Once you've done one, you get one cup, and then this is how a motivation type of a thing that we have implemented. So I'll take you to the faculty side of it.
How much it will cost per student?
Okay. Okay. So it costs between almost 5,500 to 6,000, depending on what module they take. So
The total?
uh, per year, per year. So, and it's all negotiable that we talk about. Yes.
Sir, good afternoon, sir. I'm Vivekanand, sir. I have two questions. Does it address the slow learners and the quick learners? One thing. And second thing, what is the extent of syllabus they have to cover if they are not able to cover in the stipulated time? How does it address those issues?
So one way is so for example, fast learners and slow learners. So for example, most of we've been in college. Sometimes we were behind. So here, what we can do is there is a because it's the faculty and also HOD, they will know who is falling behind. So they can take, for example, this month somebody is falling behind. So they can take extra classes, one thing, or extra, they can tell them because through here, they can ask them to take more and more practice sessions. So, and you can bring all of the students, whoever is not performing well, so to give them, additional learning material from we can give you that. So the AI will keep telling the machine learning. We have a machine learning model where it will tell if the student is falling behind or needs more improvement, things like that. So that can be done, and that remediation, you don't have to wait till the last minute before the exam. That everything should be, so you stepwise, phase-wise, quarterly, you can see how they are performing, and then change according to their learning path. And for the faster learners too, it's again one thing is they can learn additional topics from here also. So
They be able to complete this.
Sir,
yeah.
good afternoon. Hello. Good afternoon, sir.
Yes.
This is Dr. Suresh Babu from Gayatri Vidyapasha Institute of Healthcare Medical Technology, Visakhapatnam. What are the resource material you are using this in AI module are from the standard textbooks prescribed by the NMC or the university? Because when you use the AI modules, it will search from each AI module have its own. If you look at the Chat GPT, the resources it takes from so many general resources. When you look at the perplexity, it quotes the references like some of the articles from. But whatever the database you are using, is it from any standard textbooks or it is from a generalized data? Your machine learning methods, deep learning is from the standard books or it is a generalized? That is my specific question. Another second question is that do you have any e-log book for the postgraduates so that because already the time is nearing for our postgraduates to submit the e-log books, do you have the provision for that?
So we want to extend that to the PGs and also to the advanced learning.
But we have very less time, so because the first batch are appearing for the exams in few months. Already we are because as per the NMC guidelines, these people has to submit the e-log book. But till now we are managing with the manual. We don't know if NMC or in a fortnight before the exams they will say submit all the e-log books to the university or to the NMC. We can't do that. Overnight we can't do that because if you do something now with the discussion of the VC sir or the Surya Prabha madam, we can do something.
Yes, sir.
Because it is already very short time. Only we have only few 6 months time. Already 2.5 years are already exhausted.
No. Thank you, Dr. Surya. Actually, we can create, sir, within 1 to 2 weeks, less than that. So
Okay.
we can help creating that for sure. So that's what, sir. Your question regarding the material, what we have. Yes, we train with absolutely with OpenAI and Gemini, and we will also some of the places we have the textbooks content, but from generic ones.
The thing is, sorry to interrupt you. The thing is that Gaitan is the gold standard for the
Right.
a textbook for the physiology. And suppose if you look at the Gray's Anatomy is a standard textbook for the anatomy. Because nowadays what is happening in the textbooks, the content, suppose if you look at the standard textbooks itself prescribed by the university, and if you see so the student reads from the different textbooks, whatever we teach is from the standard textbooks. But what are the values, what we teach you, they don't match with the what are the textbooks they are following. Another thing, the problem after the post-COVID is that there are so many things are available like food, Zomato and Swiggy. There are so many things online freely available in YouTube. In spite of telling so much thing in clinical training, so much of time we are spending, they don't bother. They will learn the what are the mistakes they have already demonstrated in the YouTube videos just before the exam. These things are happening. Because why I'm asking these things is that when we are giving a platform from the university or the college, unless it is standardized and it is specific, because this is the going to be the when they go for the board exams or the lab, it should be standardized. Because you are the people, you are the other side of the developing, but the content what we are required is maybe not be the what we are, because the Gemini or whatever the you use they are not from the unless if you don't deep learning or the machine learning modules, so if you don't use the proper material, it will give the whatever the result available in the Google, the data sets it will use us.
Right.
The unfortunate thing, another thing is they suppose when you do the Humphrey.
I'm sorry to interrupt, Andy, Dr. Garu. This is Saurabh, Secretary Health.
Sorry, sir.
And I take your point and thank you so much. So, look, because I have to move out of the meeting, I've been following it for last 1
sorry,
hour.
sir. Okay,
No
okay,
worries, sir. Sorry, because and you can continue, sir. But let me just make my 2 cents.
okay.
Thank you so much, Dr. Chandrashekar Garu, for this elaborate deck that you prepared and the presentation that you are taking us through. We are very keen to introduce technology into the system and have all the tools available for both the teachers, the professors, and the students. While taking into consideration the concerns that have been raised in terms of standardization of the material, and I'm sure you will talk about it. But yeah, what I also feel is I've been handling education for some time now, as higher education secretary, and before that in interim education, where we had introduced these kind of tools. And the way we had put that was, and I'm sure you will also agree to that, is that whatever is produced, the body of knowledge through the system, through the ADMET AI is produced, is taken through a group of experts within the university or by a panel of experts pulled from various colleges. Now they do the corrections in terms of if there is anything that they find, and it can be all again driven by AI, made available through the platform, so that it goes through a scrutiny, and they say whether it is okay, not okay. It can be a simple thing if it is a MCQ based thing, or it more elaborate. They can offer remarks also, which is again read by AI. It can be democratized so that it is made available to 4 to 5 to 6 people, and they are deciding. And I'm sure you would have done it also. I'm not preempting you from saying anything, but there are solutions to that. Now, having said that, what I request is that I find it quite useful. This is the direction that we are willing to take. We'll have to look at what is the procurement mechanism also. My request to the registrar, to the vice chancellor would be that have a very clean cut manner of procuring it. I'm sure this is a great tool at AI, but we'll have to follow the procurement norms when we look at this. And before procurement, let us do a pilot. Let's also do a validation from the experts within the university. So I'll stop here, and I look forward to interacting further. I have the deck now. If you can send us a video description or video recording of some of the salient features of your platform, of the learning platform or the LMS, that will also be useful for us to evaluate it from administrative perspective. So ఇదే అండి, ఇది బాగా మంచి పని చేశారు. లోకేష్ గారు కూడా ఉన్నారు, డాక్టర్ లోకేష్ ధారా. థ్యాంక్ యూ సో మచ్ సార్, యూ హావ్ బీన్ ఛాంపియనింగ్ దిస్. కాబట్టి ఇట్లాంటివి తప్పనిసరిగా చేయాల్సిందే. దాన్ని ఎలా తీసుకోవాలనేది ఒక సరైనటువంటి రూపంలో అనేది మీరు అందరూ వర్కౌట్ చేసుకోండి, అండ్ విల్ బి దేర్ టు సపోర్ట్ ఇట్. ఐల్ స్టాప్ హియర్. థ్యాంక్ యూ.
So, thank you so much.
Thank you so much, sir.
Secretary.
I think it's excellent. We need this model definitely, and I think I would also need to request NMC from about changing it, the assessment modules to 100%. Give the freedom to the NTR university. That is the
అది
one changing.
చేద్దామండి.
So that's what. Yeah.
I think NMC, or because in higher education, at least we are not finding that the universities are sufficiently empowered through their governing board. They could do that. If NMC has a role to play also, we will look at that and figure out how it works, Andy. But I
It's
believe Dr.
amazing. Yeah.
Chandrashekar, you wanted to say something, sir?
Sir, actually, last month I visited NMC too. I met the president of NMC, Dr. Ramesh, sir, and presented it to them. So he was impressed and also said this would be very helpful to the colleges and the students. So it would be very helpful for even the NMC so that they don't have to visit too many times. So that was his comment, sir. But we will try our best, sir, as said. And last time, VCR said that we will conduct 2 pilots, one private medical college and one government medical college for now. And we will go through each and every module, each and every competency to see if the content is coming good, if the images are doing well, if the quizzes are appropriate. So, and the flow, how it's coming. So that's what VCR has said. So we'll definitely do the pilots. And I'm open to any suggestions from the administration and the faculty.
You have dialed. ఈ నంబర్ ఉపయోగంలో లేదు దయచేసి మీరు డయల్ చేసిన నంబర్ సరిచూసుకోండి आपके द्वारा डायल
So can I continue, sir? Thank you, sir. Okay. So this is on the
Sir, good afternoon, sir.
Sure, sir.
Good afternoon, sir. We would like to appreciate Dr. Chandrashekar, sir, Vice Chancellor, for introducing AI in medical education, which is going to be the future, not only in medical education, but in other sectors like even in research. AI is going to be lead these things. And I have one particular doubt, sir. Can we assess the students while taking the class? Can we assess the students at the real time?
Yes, sir.
For example, if we prepare an MCQ and we will display while taking the class, if they reply in the class itself, can we monitor it at real time and can we give the feedback at real time?
Yes, sir. We can do that, sir. So if you see, like. So here we can see, if you see, sir, from the faculty side, sir, this is online. So you can generate lesson plan here, and the title is like. So you can give the learning objectives, it will create a lesson plan for 1 hour.
Okay.
I'll show you even the quizzes where you can create.
Sir, one question, is it good to implement by university or through the NMC to get a uniformity? What is your opinion?
So, I mean, at the state level, sir, the university, see, it's like if one university implements it and if it works good, then it can be implemented in other colleges, and NMC can take this as a model. And if it is working very well in Andhra Pradesh medical colleges, so they can take this as a model state and implement in other colleges, so that overall NMC can, all the 800 medical colleges can do the same thing at the same level. So all the students, faculty, everybody will be on the same page. So yeah, to answer your question, sir.
So NMC given the permission to the universities, so we need to work on that, right?
Yes, sir.
Okay.
So lesson plan is created. So you can also create a group activity here, just like how you in 15 minutes, 20 minutes, even in the classroom. So you can create a group activity like this topic. You can give any topic.
Sir, any other central institute is implementing this, like Indian Institute of Medical Sciences, Delhi?
No.
Not yet, sir. So we have reached the director of AIMS, Dr. Srinivas Garu, and we asked for a pilot. So he was kind to agree for 1 month. So, but still in talks, sir. So they have not implemented it, sir.
So this implementation will put our MBBS students #1 globally, because I'm been championing medical education for the last 20 years. This will give the active education. This amazing. This is what we have to do.
Yeah. So I totally agree, sir. And in the next 5 years, we can, because AI standardizing all the